Australia and speak to Michael Toole, who's an Associate Principal Research Fellow at the Burnet Institute. It's an independent organisation that combines medical research with practical action to address health issues globally. Thanks so much indeed for your time, Michael. From what you've been hearing about what's happening in China, because it seems as if you have to kind of read between the lines, look at social media outlets to get the biggest picture possible. How worried are you?
Well, first of all, good morning in Europe. It's evening in Melbourne. As a journalist, you probably won't welcome the fact that I'm in two minds about the imposition of PCR tests before Chinese travellers board their planes. Now, first of all, I understand that the information we're getting from China on COVID is inadequate, and the Director General of the WHO, the World Health Organization, has pointed that out twice in the last week. And I've been following the data. Officially, China has been reporting around about 4,000 COVID cases a day and 2 deaths a day from COVID. Now, compare that with my country, with a population of 25 million. We've been reporting around 15,000 cases a day and around 20 deaths a day. So there's clearly a problem with the Chinese data. And I think what concerns the WHO and scientists around the world is how are we getting real-time data on the variants that are spreading in China. Now, I've worked in China for more than 30 years, off and on, and I know they have the capacity to do this genomic testing, but probably only in around 10 cities. Now, given the anecdotal evidence of massive spread of COVID in China, I'm nervous that in rural areas where there is no genomic testing, that we're not getting real-time information. So I understand why countries like Australia are imposing these, I wouldn't call them restrictions, because I don't think it's very onerous to get a PCR test 48 hours before you catch a plane. I've done it myself several times.
Michael,
so that's my argument in favor of these restrictions.
Yeah, I mean, look, quite understandably and actually helpfully for us, you're coming at it from a scientific point of view, so let's carry on in that vein. Is it counterintuitive to the science that China should be opening its borders just at the moment that it's suffering the biggest wave of the entire pandemic?
Yeah, I think I would remind your viewers that China insists that all international travellers into China must have the same negative PCR test before they board the plane. And that seems to have been downplayed by China itself. Now, on the opposite side, I'm concerned that at the moment, the variant of most concern is something called XBB 1.5, which emerged in New York. Now, it is by far the most transmissible variant. And yet no country that I know of, other than China, is insisting on US travellers being tested before they travel to other countries. Now, the other problem I have is that many of the countries that have insisted on these pre-boarding tests are not doing very much to control COVID in their own countries. And I can talk to my own country, Australia, where basically all the protective measures have been dropped. The only thing we have left is vaccination, and our 3rd dose booster rate is very low and hasn't changed in 6 months. So I think there's a little bit of hypocrisy here that we're insisting on people coming from China should be virus-free, but in our own countries, we're not doing enough to control the spread of the virus. So a few infected Chinese travellers coming into our countries like Australia may not make much difference.
Yeah, absolutely. But you know what? That issue of 2.1 billion journeys in the next 40 days, most of them, almost the vast majority of them being within China. So we'd have to see in a few weeks what that would do to the transmission within China and therefore how it might affect the rest of the world. But Michael, if you don't mind, you mentioned, and I've got to read it because I'm not a scientist, the strain, the variant XBB 1.5. The CDC in the United States says in the northeast of the US, that particular variant is causing 75% of new cases and is doubling its share of the pie of infections every week in other parts of the United States. Do you know anything about that variant and how dangerous it might be? Is there enough research on it?
I know as much as I can. I'm not a virologist, but I do know, and I follow the CDC figures. Now, this variant was not imported into the US. It arose spontaneously in New York. And in the northeast of the US, it's, as you said, around 75%. Now, it has not been shown to be a more severe variant, but it is very adept at evading the immunity that we have acquired from vaccines or infections. Now, even if it's no more severe, if we get more cases, so a large number of cases, then even if it's mild, that small proportion of people who get severe illness will be a large number. And that's what we are afraid of.
Right.
So this XBB 1.5 variant is very scary. And in China, the scale of China is so much greater than any other country, including the US, with a population of 1.4 billion. So the chances of yet another variant arising in China are much higher than any other country in the world.
Yeah, absolutely.
Now,
Michael, sorry, we're going to have to leave it there. The production team is telling me that we have to move on, but I really, really appreciate it. We all do, of course. Your expertise helps all of us. Michael Toole in Melbourne, Australia. Take care, Michael.
Okay, and welcome from Melbourne, where we have a very large population of Turkish origin.
Thanks very much.